Hello and welcome. I'm Joanna Junak and this is GFN News on GFN.TV. In Uganda, 8% of the adult population are current smokers. The country has legislation that regulates tobacco smoking as well as e-cigarettes. E-cigarettes are categorized as electronic nicotine delivery systems, and under the Tobacco Control Act, the manufacture, importation, sale and distribution of these products are prohibited. Joining us today to discuss the tobacco harm reduction situation in Uganda is Sawa, a tobacco harm reductionist from Uganda. Hello, Joel. First, can you tell us more about yourself?
Okay, so I am a scholar and ultimately harm reductionist in training with the KSC currently under the THRSP program, that is the Tobacco Harm Reduction Scholarship Program. And I work with the THR, other than that, I work with the THR Uganda.
What's happening now in Uganda, where you live, in terms of used combustible cigarettes and the harm reduction situation?
Okay, so in Uganda, we have the Tobacco Control Law 2015 that was enacted back then, which has inhibited a lot of work that revolves around THR. For starters, you're not able to sell, import, or trade in any form of electronic cigarette starters. The law itself was a blanket ban that did not put into consideration it did not discriminate between forms of nicotine intake. It simply closed out everything that is not pharmaceutical. So you're not able to access electronic cigarettes, snus, or anything like that readily on the market, other than on the black market, and other illicit forms of nicotine that are coming in through importation from places like China and the like the disposable vapes, some of them which are harmful. Other than that, we see a lot of hassle when it comes to disseminating this information, because some of the people we talk to are not really receptive, because they feel like they will be contravening the law, because the law itself is not supporting THR as it is.
Do you think tobacco harm reduction is a good tool to reduce deaths and harm from disease?
Yes, I do. Yes, I absolutely do. In my experience with the THR, I've learned quite a lot, and I've come to the conclusion and the understanding that it is the right resource, the right tool, the right paradigm shift from cigarette smoking. It presents a promise that is life. We look at the information that is readily available that states that electronic cigarettes are 95% safer than combustible cigarettes. This is not a lie; it's a proven fact. In fact, it is proven by the very fact that as of 2021 there were 82 million recorded vapers globally. Now, the number will not be increasing if not for the fact that people in the current century are more wellness and health oriented. Hence, people have actually realized these benefits even without some government interventions, and they're making the switch. So yes, I support THR and the promise it presents.
Can you tell us more about THR projects you are running in Uganda?
My project is called THR Uganda Information and Dissemination Project. It revolves around an establishment of an organization, a THR-centered organization that is going to that is essentially about information dissemination. We are focused on educating the masses. We believe that once people are educated, then people will organically come up and speak for themselves and get the government and the policymakers as well as the stakeholders listening. Because if people are not educated on the various options that they have, because in Uganda as it is, the smokers do not know. Many of the smokers prior to our project did not know that they had the chance at life. They did not have information of safer nicotine products, or even so low risk nicotine products, other than the pharmaceutical products that are available on the market that are less desirable. And in us engaging the various communities, including the communities of smokers, we've come to realize that actually with the more information and the more information you give them, the more empowered they are, the more they are able to go and face even some of their community leaders at the grassroots level. That's made. So there are these products, there are these, not rather, there are these alternatives that we are getting or we've been informed about that are in existence, but we have not seen them on the Ugandan market, nor have we heard about what is the problem. So then this raises a discussion and a dialogue as well as a conversation around tobacco harm reduction and nicotine in itself, right from the grassroots level, because the people affected are the people at the very bottom of the age, at the very bottom of the ladder. Yeah, the people who are less educated, the people who are less privileged. Yes.
What benefits could Uganda achieve if it adopted tobacco harm reduction?
That's without thinking too much. For starters, reduced deaths, reduced diseases related to cigarette smoking. That is the biggest problem that Uganda faces right now. 10,000 deaths plus registered annually as a result of cigarette smoking and related cigarette smoking, as well as related matters and diseases. So there are several challenges that come as a result of cigarette smoking. Yes, there is the health challenges and the deaths that as a result. So these will very quickly be curbed and reduced drastically. Yeah, we know Uganda lies in the recorded low middle income earning countries, and these are the countries that are most affected. If you look at on the global scale, it is estimated that 80% of the deaths come from these regions, and the number is increasing over time. So if Uganda is able to create avenues that are conducive for adoption of safer nicotine as well, or rather THR, we will see a drastic change in terms of the deaths that are related to cigarette smoking, and even so, this burden, the very heavy economic burden that comes upon the government to see to it that these deaths present a very economic burden on the government. Then the government is able to switch these funds to other fundamental matters of the economy or even so in the country. But the health benefit of switching of giving an encouraging environment for THR and SNPs is definitely a viable option.
Do you think the Ugandan government supports THR?
Absolutely not. We as THR Uganda are pioneering this feat. We have pioneered information dissemination. We have pioneered engagements at policy level. Okay, we have pioneered advocacy around THR, tobacco harm reduction. It is a whole new thing that very few people have thought about or even so had an interaction with. So yes, in terms of how government support, no, we do not have government support. We don't have government backing on this because the government was fully behind the establishment, or rather the enactment of the law in 2015. So many times, if you come out strongly against a law that has already been passed by government, you look rebellious. You look like you're opposing the government, because things in Africa tend to be somewhat political. Everything, even that which is not. So that's why, like I mentioned earlier, we do not come on as aggressive in our bid to have THR and safer nicotine, or rather low risk nicotine products discussed. We simply engage with dialogue and understanding. We're not combative. We simply allow for room for discussion. So yes, over time the government will be receptive. We believe over time the government will have that. We'll have that hearing, that ear and eye to see the benefits of it. But as of now, no, we do not have that benefit of being supported by government.
And the last question, Joel: which country in the whole of Africa has the easiest access to safer nicotine products, and how does Uganda compare?
Off the top of my head, I could think Kenya is quickly becoming one of those places. South Africa would have been, but the latest legislations in South Africa are very detrimental to the cause. So right now in Africa, we are faced with the challenge of legislations that don't favor SNPs or THR for that matter. And where does Uganda lie in all this? Uganda lies in the red zone. The red zone meaning one of those places where legislation is strict and toughest. Uganda adopted a law that is a landmark law for starters. It is one of the most strict law the most stringent law in relation to tobacco and electronic cigarettes for that matter. Uganda is regarded in Africa as the center of it is the central point for tobacco control for Africa as a whole. So you can imagine the kind of opposition you'd have to face before you get the kind of opposition rather we face before we get people to understand the necessity of having an adoption to THR. So Uganda is not very favoring at the moment, but we are hopeful that with continued engagement, because that's what we do in advocacy, we continually engage the community, engage the stakeholders, engage the policymakers, engage the influencers, and we do not come out, we do not place, we do this without, we do not put negative aggression into our cause because it has backlash, but rather we pursue dialogue continuously. We pursue dialogue, we pursue information and knowledge exchange. So that is the angle we've taken. Hopefully Uganda will be, hopefully I'd say if you ask me to give you a full sight or rather forecast of what things will be in some time to come, I'd say in the next, if we are very ambitious, 2 years. If we are moderately ambitious, 4 years. If we are slowly ambitious, 7 years. So yes, let me start with the 4 years. In 4 years, I believe Uganda will have come to a point where people are able to, the country is able to positively sit down and discuss THR as a viable option for public health and the like. So yes, that's where we are, at a place where right now it is not a place where you can easily access these items or rather this information. But 4 years from now, on the basis of the work we're doing and the engagements we're having, I believe the country will be in a place where these discussions will be held in higher places, because THR in itself is a concept that attracts, it is a highly intellectual concept. It's not a matter that is light. So it attracts discussion, it attracts dialogue, it attracts debate. And that's a good thing, because intellectual debates lead to intellectual results.
Thank you, Joel. That's all for today. Don't forget to book your place at GFN-23 to join in the THR discussion yourself. Thanks for watching or listening. See you next time.